Hi, this is a hopefully brief update on what's been happening. I know it's been a long time since I did a video update. Um, I have pretty bad news and some good news as well. So the good news is that my non-profit organization has been officially recognized by the Japanese government. This is a very long and stressful application process. There's a huge amount of paperwork, most of which has been done by a member of my team, Dr. Hoshino. And yeah, it's just fantastic that we are now an official non-profit organization. This will open many doors for us in Japan. There's just a whole bunch of things that are easier to do as a non-profit. Maybe surprisingly, you don't get a lot of legal benefit from being a non-profit in Japan. For example, until you've been operating for a certain amount of time, donations are not tax deductible. Now, that's not a huge big deal in Japan. It's not like in the US where companies just won't donate to a non-profit unless it's tax deductible. But yeah, it would be nice if corporations donating to us would get a reduction in the tax bill, but that won't happen for between 1 and 3 years. So yeah, that's the big bit of good news. I've been doing a lot of work over the last few months helping cancer patients, and that's been really rewarding. And yeah, it's going really well. So I've been helping people get access to treatment in Japan. I've been doing video calls with cancer patients who are looking at treatment options. I never give medical advice, but I sort of can tell people the kind of areas they could look at, or particularly questions they should be asking their own doctors. And I do give people help with like frameworks of how to make the treatment decisions. So that's all been good. I was interviewed by a cancer non-profit here in Tokyo last week. And it's a non-profit called GAN Note. GAN is the Japanese word for cancer. And that non-profit has been working for 10 years, sharing stories of cancer patients. The non-profit was started by a cancer patient, and he found that he was getting a lot of useful help from other cancer patients, particularly in areas that his doctors weren't helping him with, like financial situation, psychological and emotional health, how to talk to family members about your cancer, that kind of thing. So that NPO has been going for 10 years and has published hundreds of interviews. Their interviews are generally 30 minutes long or 90 minutes long. And this was their first time to do one in English. So it's going to be published in English with Japanese subtitles. So the questions are all in Japanese, and my dear friend Dr. Hoshino was off camera interpreting. So when it's published, there'll be the interviews questions in Japanese, my answers in English with Japanese subtitles. But I think, yeah, the interview went really well. I think it was very useful. It covered a lot of areas about what it's like to be diagnosed with cancer when you're relatively young. I was 36, I'm now 44. And also the NPO is very interested in what it's like getting treatment in Japan as a non-Japanese. So there are lots of interesting topics there. The person interviewing me was the founder of the NPO, and he had a rare cancer when he was, I think, 25, and he had treatment, and it seems to have been very successful. All cancer treatment is tough, but he was visibly visibly shocked when he asked me about my treatment side effects, and I talked about what it's been like to have 8 years of cancer treatment. Within that there was sort of a year with no treatment and 6 months with very light treatment. So there's been a lot of treatment and a big variety of treatments. So I explained some of the side effects and the various combinations of side effects I've had. And yeah, even though he was a cancer patient, he was quite surprised by how much stuff I have had over the years. So coming up to, well, I'm recording this just at the end of June. So next month will be 8 years since my terminal diagnosis. And the prognosis, so kind of prediction of how long I'd live, at that time, the average for people in my situation was about 7 to 9 months. That's using the data that was available then. So I was diagnosed in 2016. When you look at the statistics of how long people are going to live with cancer, you will look at the 5-year data, so past 5 years. So based on the 2011 to 2016 data, I had kind of 7 to 9 months to live. Now we can recalculate it by looking at the 2016 to 2021 data, and it's a bit better, maybe about 15 months, and that's with treatment. So people in my situation in 2016 turned out the average life expectancy was about 15 months. The 5-year survival, that hasn't really changed, and regardless of whether you use 2011 data or 2016 data, you're looking around 0.5% or 1%. So very, very, very few outliers. It's starting to change just a little bit for colorectal cancer because of a group of drug therapies called checkpoint inhibitors and also a combined surgery chemotherapy procedure called HIPEC. Those two things have helped a little bit, but not massively. So yeah, so it's kind of amazing to be here almost 8 years later. Unfortunately, the bad news is, last week on Monday I had a CT scan. I have a CT scan every 3 months, and I got the results on Friday, and the results are pretty bad. Cancer growing and spreading in both lungs and in the lymph nodes, in like the center of my chest, and particularly growing and spreading in the lymph nodes in the lower abdomen. So these are called para-aortic lymph nodes. So the aorta is the huge pipe that comes down from your heart. So the abdominal aorta. But yeah, I guess it goes up as yes, there are big pipes coming from your heart. One of which is the abdominal aorta, which goes, I think it goes down and then splits off into the femoral arteries that are like the 2 massive blood vessels that go into your legs. So there's a bunch of lymph nodes around there, and the cancer's spreading in there, spreading in my lungs a bit. So this is pretty bad news. The good news, which has been true throughout all 8 years, is because I've been kind of very careful about what treatments I've done and the timing, and about having treatments at the same time where possible. my body is still in reasonably good condition. I'm yeah, over the 8 years I've taken a lot of really quite toxic drugs, and interestingly, as time goes on, some of these newer drugs turn out to be more toxic than the pharmaceutical companies originally claimed. There's a surprise. So Avastin, which is or bevacizumab is a generic name, it's a really, really important life-saving cancer drug. Yeah, that's certainly one of the reasons I'm alive. It's a relatively new drug, and well, relatively new. I mean, I think it's been used probably for like 15 plus years now, but the backbone cancer drugs have been used for like 40 years. So in cancer terms, it's a relatively new drug. Yeah, that's proving to be considerably more toxic than than was originally claimed. So particularly with long-term use, it damages many, many, many systems of your body systems that you need to live, like your metabolism. So yeah, over the years I have taken a lot of damage, but generally I'm still in pretty good condition. But still, I'm now in a situation where I need to switch to a more toxic, less effective treatment. So I'll probably start treatment called Lonsurf with more Avastin. And yeah, it's not an effective chemotherapy at all, really. It hopefully will slow things down, suppress things for a bit. But maybe combined with immunotherapy, yeah, I could turn my situation around, which is obviously what I'm aiming to do. So I'm desperately raising funds for immunotherapy. So it's really helpful if you can share my fundraising link and or make a donation. It's massively helpful. Another possibility for my treatment regarding the chemotherapy side of it is to go back to an earlier, considerably more toxic treatment. So I'm in an unusual position, I guess, for cancer patients, which is that earlier treatments that I was doing, I stopped because they were too difficult to deal with. Like the side effects were too horrific. But I didn't stop because those treatments were no longer working. So the treatment I've been having, TS1, which is an oral chemotherapy with Avastin, that has stopped working, it seems. But I could potentially go back to, really unpleasant treatment like irinotecan, TS1, and Avastin. So like do a triple treatment. So that's in the back of my mind. So that's what I'll be discussing in the next couple of weeks at various hospital appointments. I'm switching to a different hospital because although I was at a university hospital, Showa University Hospital, it's not one that seems to do many clinical trials. They don't seem very interested in treating patients with unproven treatments. So I'm hopefully changing to Tokyo Medical and Dental University Hospital, TMDU. And from what I've heard, it seems more likely that they will be able to get me into a clinical trial or possibly treat me with a drug drug combination that's not approved yet, because there are trials happening all around the world, and sometimes good treatments are found, and then it takes a few years for the various health systems around the world to approve the drugs. They often countries will often want to redo trials that have been done in other countries just to make sure. And Japan is very much one of those countries that likes to essentially redo clinical trials. And that there's very, 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 very good sound medical reasons for doing that with these drugs, because how your liver metabolizes the drugs has a big effect on whether it works and also the toxicity. So people with a different genetic makeup, so maybe Asians or Japanese people, may have different enzymes is a key one. So they may be lacking an enzyme that is used to break down a certain chemo drug, and therefore the dosing for people in other countries may be perfectly safe and may be deadly in Japan. So it does really make sense to do these trials again. However, there are issues about waiting for treatments. So if I can find a promising treatment that has been just approved elsewhere, or is about to be approved, or at least has been proven in trials and will be approved in a few years' time, if I can access that treatment earlier directly from the pharmaceutical company, I could be treated with that treatment at the, it's not tautology, treated with that treatment, but yes, I could be given that treatment at this hospital I'm changing to, Tokyo Medical and Dental University Hospital, which potentially could improve my situation a lot. So that's where things are at the moment. So very good news about the non-profit, and it's been good helping other cancer patients, and lots of big exciting projects coming up with the non-profit, which will now be accelerated because we've got the approval. But bad news is quite a bit of cancer growth and spread. One other thing I'm going to do is do a genetic sequencing test, a gene panel test. So gene panel test is when the cancer is tested for a selection of mutations. So I think this test will look for, I think it's like 60 or 70 mutations, of common cancer mutations. And I did this test in 2018, so maybe the cancer has metamorphosized a bit and there are some new mutations that could match to certain drugs. This test is an example of what's called liquid biopsy. I am very, very, very skeptical about liquid biopsies, not just because the claims made by the companies are just nonsense when you look into it. There's issues about sensitivity, so that means like if the test's not sensitive enough for the patient, it could miss important mutations. So for example, this test I'm going to take, Guardant 360, at least in the past, the sensitivity was only about 60% if the patient just had small tumours in the lungs and lymph nodes, which was the situation I'm in. Now I have larger tumours in lump and lymph nodes, so maybe it will be more sensitive. But that's quite a big deal if it's potentially missing some mutations. And yeah, you see these liquid biopsies that claim to like match you to treatments and trials and stuff. I look into these regularly, and yeah, they are being very sloppy. They are, yeah, making claims that just don't match reality. So yeah, I'm very skeptical about liquid biopsies, but potentially in the future will be a wonderful, wonderful thing, because as the name suggests, liquid biopsy, these are done like with blood tests, so they don't have to use tumor tissue. Yeah, so much less invasive for a patient. So that's, yeah, one thing I'll be doing in the next few weeks is taking the Guardant 360 liquid biopsy test again and seeing if any useful mutations have appeared. Okay, I will definitely do an update after my next couple of hospital appointments, which is where I'll actually have some more information. But yeah, please do share the fundraising link if you're comfortable doing so, because that helps me pay for the immunotherapy, which in all these 8 years seems to be the key thing, is having this very remarkable immunotherapy in Japan, which is grown from my own white blood cells. It's horrifically expensive, but essentially completely non-toxic. Yeah, I think in the time it's been used in Japan, there has never been kind of a critical event where someone's had to kind of go to hospital as a result of the immunotherapy. There have been, some people get maybe a fever, or maybe some kind of reaction where they to stop immunotherapy for a bit, but it seems to be super safe. So yeah, that's a really big deal for me. If you can share the link on social media or whatever, and make a donation if you can, that obviously has a massive impact on my ability to continue living. Okay, another video soon, and yep, thank you so much for being interested in my situation. Thank you, goodbye.